All right, good afternoon, everyone. Apologies for the slight delay. There was a little IT glitch and some of us were ending up in a different meeting. So I'm just going to give one more minute for a few of our board members and HRSA colleagues to get transferred over. And Tennille, I may ask you and some of our team to monitor the inbox in case there's any folks who are still having trouble.
Yes, I'm watching the inbox.
Perfect. All right. Why don't we go to the next slide, please? And thank you all so much for joining this OPTN Board of Directors meeting on July 1st. This is our agenda for the day. We will have a quick welcome. Then we are going to take quorum for our new board members and approve the call for this special meeting. We will have a very special call to purpose, and we have two patient, family, and donor representatives with us, and we're so excited to hear from them. We will do board of directors introductions as you all continue to get to know each other. We will then have a couple of voting actions to ratify the election results for the directors and our new officers. We'll then do a brief presentation on the Invest insurance coverage and our plans for that. Then we'll move into a short session on creating the board culture that we want to have moving forward. We will also spend some time discussing OPTN board priority activities. And then we will move into a closed session to discuss some topics before adjourning. So that is what we have on our agenda today. So if we could move to the next slide. And I am going to turn it over to our newly elected board president, John McGee, to say a few words. But before I do that, I'll just say on behalf of American Institutes for Research, we are just so feel so honored to be working with all of you as the new OPTN Board of Directors, and are looking forward so much to collaborating with you. And John, I will hand it over to you for any additional opening remarks that you would like to make before we get started.
Thanks, Christine. Can everyone hear me? Can you hear me okay?
We can.
Okay, great. And my camera, for those not aware, the election results were just released, and we had a pre-meeting before this, and I'm transitioning between cameras. So is my camera working or not?
Let's see. I am not seeing you anymore,
right. Well,
John.
Well, I will try to either pay attention to this meeting or fix the camera. But I wanted to welcome everybody. Very excited about the possibilities, the future ahead. I really applaud everyone for serving. I both want to recognize the current officers as well as everyone who stepped forward. There will be lots of leadership opportunity as we progress through this year. And it's a great responsibility, but I know we're up to the challenge. So this meeting is going to be largely run by the AIR team, as you have seen on the agenda, and we'll kind of go from there. So I think the key will be to get our legs underneath us, get a good assessment of the current issues that are facing the board, and again, welcome to everybody.
Wonderful. Thank you so much, John. Let's move to our next slide. All right, so the first thing we're going to do is establish quorum. So per the bylaws, we have the right number of people to be able to take voting action. So for our newly elected board of directors, we are dropping a link into the chat. and we ask that you complete that quorum. It's just to establish that you are here and with us. So we have that recorded before we move into voting items. So I will pause to give everybody a minute to click the link and complete that quorum request. Okay, we have established quorum. Thank you so much for letting us know that you are here. So let us move to our next slide. Okay, so this first meeting of the board was called via a special meeting request from the previous board president, and he requested that HRSA call this special meeting where we are essentially seating the new board. So per Delaware law, which is where Invest is incorporated, and per the OPTN bylaws, we are going to essentially approve that this special meeting is going to take place. So I will just pause for a moment to so everyone can review this special election approval of special meeting language. And usually our board meetings, there is a certain amount of notice that has to be given, but because this is a special meeting, that's why we are waiving the notice that this special board meeting is occurring.
Does this require any action on our part?
Yeah, we are going to be voting. I just wanted to give people time to review this. So John, as president, do you have any, I wanted to give you a chance to say anything. Otherwise, is there any discussion from the group before we move to vote?
Thank you, Christine. I think many of us have looked at the slides ahead of time regarding the specifics. And so do we need a motion for this, or do we need
We do.
Okay.
Yes. So if
So
someone
we
could.
If we have a motion to support the.
Move approve.
Alan,
Second.
and second.
Motion to approve.
Sorry, who was the second?
I'll second.
Perfect. And any further discussion? And Christine, are we voting electronically or are we voting simple aye?
We are voting electronically. We are going to put a voting link into the chat, and you will
There's a
see
question.
that. Oh, I'm sorry.
Someone has their hand up. Someone has their hand up.
Let me see, scrolling back through to see who that hand is. Yersinia.
Yes, is this to bypass this being part of a public meeting?
It's being live streamed, and Yersinia, this is a vote for the board just to move
Correct.
for, yeah. So it's because there was not the usual 30-day notice between when the new board and the officers were elected and when the previous board rolled off to hold this special meeting on the first day of the of our new board's term. We are essentially moving to hold a special meeting, which according to the bylaws allows us to waive that 30-day notice.
Understood.
Yeah, thank you for the question. Any further discussion or questions?
I guess we can call it for a
Okay.
vote then. It will be in the chat.
Yes. Yes, we will put that voting link in the chat. And there it is. It's a Microsoft form. And again, if you are a board director, please cast your vote. Okay, we have 27 approve, 0 reject, and 0 abstain. So this motion passed. We can continue with this special meeting. So thank you very much. Let's move to the next slide, please. Okay, so now we are going to have our call to purpose. We have 2 patient representatives who are joining us today, Yersinia Diaz and Patty Droughty, and thank you both so much for joining and for sharing with us today. Yersinia, I will turn it over to you first. Thank you so much.
Thank you. Good morning, everybody. It's with deep humility and immense gratitude to God that I stand before you not only as a professional, but as a survivor, a 2-time kidney recipient who was once a critically ill child with limited options. My life has been shaped by extraordinary and compelling circumstances that have led me to witness firsthand the broken places in our healthcare system. Born to a Puerto Rican father and a Cape Verdean immigrant mother, I am rooted in communities that historically have navigated exclusion, and now I fight to redesign systems that reflect our full humanity. I was diagnosed with end-stage renal disease as a child, receiving my first transplant at 10 and my second one when I was 20. Navigating life on dialysis through the health inequities has propelled me to become and be integrated in trials that serve as the catalyst to propel me from patient to practitioner. From surviving the system to seeking its transformation, I've earned degrees in science and anthropology, as well as studied many interrelated fields. I've founded and led many initiatives to be part of a broader commitment to advancing equity-driven infrastructure and systems-level reform, bridging construction, public health, as well as community development to serve historically underserved populations. And I'm committed to rebuilding systems for those still waiting. It's within the context that I align with the reformative vision of the HHS, whose systems-based leadership in public health illuminates the path forward. The HHS commitment to dismantling disparities, particularly amongst our Blacks and Hispanic communities, are not a concept to me, but a calling. We are united in believing that policy must reflect purpose and equity must become operational. I honor HRSA's leadership, including Dr. Raymond Lynch and Stephanie Grosser, and all members of the Transitional Nominating Committee, including our chair, General Janet Wolfenbarger, for our tireless commitment to inclusion and systemic transformation. Together, this historic board is positioned to rebuild paradigms, not merely to restructure governance, but to reimagine access, transparency, and ethical integration in transplantation. I thank Dr. Richard Formica, outgoing president of the OPTN Board of Directors, for his service, leadership, and stewardship throughout a critical and careful transition in the organ transplantation system. This tenure has helped him and the OPTN network extensively lay the groundwork for transformation we now carry forward. I would like to extend a heartfelt gratitude to the American Institutes for Research for their continuous dedication and support in slating such a historic board. I also want to give deepest thanks to my medical staff, including Joseph Aziaf of the Pediatric Associates of Brockton, the Floating Hospital for Children, and Tufts Medical Center for their extraordinary and my extraordinary journey through a team effort. Dr. Lawrence Milner, Linda Mazzola, and Pam Levy. I'm also very grateful for the Visiting Nurse Associations, my transplant surgeons, Dr. Richard Rohr, and the care provided by transplant surgeon Dr. Jeffrey Cooper, Deb Brasler, transplant coordinator, nephrologist Dana Miskelin, and physician assistant Lori Larson. I'd also like to extend special thanks to our institutions, including the Brockton School District, the University of Massachusetts Brockton, and attorney Patrick Choi for propelling me into the call to purpose. To the Commonwealth of Massachusetts and Mass Health, and also the United States government for Medicare. And thank you for making healthcare accessible for patients like me. And finally, to my family and friends and community, their steadfast commitment and support has been the foundation to my purpose. So I call us to elevate the voices of Indigenous communities, vulnerable populations like those incarcerated and immigrants, to globally serve underserved populations. Let us inspire future leaders born from pain but fueled by purpose, To the incoming OPTN board, you're not just inheriting responsibility, you're inheriting this mission. Be bold, be anchored in justice, and be relentless in ensuring that no life is left behind in the systems that we've shaped. Let us lead with moral clarity and institutional courage. May this era be one where transplantation reflects not only scientific excellence, but also human dignity. Thank you.
Yesenia, thank you so much for that. And thank you once again. I want to publicly thank you for your participation and your time and effort as serving as a member of the Transitional Nominating Committee as well. So thank you so much for being with us today.
Thank you for sharing that. Good.
Wonderful. All right, next I will pass it to our next patient representative. Patty, thank you so much for being with us, and I will give you the floor.
Thank you. Good morning, everyone. My name is Patty Dorati. I am an RN. I've been an RN for more than 25 years. And as a sister, I have a kidney transplant recipient as well. My role today, however, is as the aunt of a patient, Chris, who was referred by a hospital to an OPO. Every year, more than 1 million patients like my nephew are referred to OPOs for evaluation, examination, family authorizations, and to coordinate care to procure their donated organs. Chris's experience and our family's experience may not be one that you hear of very often. I assume many of you hear about what happens when a patient donates organs. I'm not sure you hear about what patients who don't. However, in this new time, this new board, and this new opportunity, I'm hopeful that the time for change is finally here for people who can listen to those of us who have been affected and had bad interactions. Families should not have to go through what ours did. That's what makes Chris's story matter right now. What happened to him should not happen to other patients. I would just like to take a few seconds to tell you about Chris. He is he's a very loyal son. His dad died a few years ago, and he stepped up and took care of his mom during that process. And Chris has a huge passion for history and has recently decided to go back to school and become a history teacher. He is also a dad, single dad, with 2 small children. And right before the accident, he moved to a small town, bought a home, and was raising his kids by himself on a farm. Sorry, it's very hard. Chris was a very generous person. He was someone who registered to donate his organs as a last act of kindness. We never thought it would lead here, but I can tell you that all that knew him knew that helping someone receive a life-saving organ transplant was just what Chris would want to do. But unfortunately, that's not what happened. Through being referred to OPO's care and intervention, Chris went from being a patient to being someone with less care, less protection, and a potential organ donor. And that's where things took a really bad turn. Turn off your mom brain. When looking at Chris to make this decision, do not think of him as your son. We were told that 8 families were suffering. And if we would allow them to administer a drug, the whole process could be done within 3 hours. And those 8 families suffering and planning funerals could start planning the rest of their lives. Unfortunately, there were 9 families that were suffering. But their response to us was, let's get this done. Let's plan his walk. And so these families can move on with their lives. These were just a few statements that our families heard once OPO got involved. Once OPO decided that Chris's organs were up for donation. When Chris was admitted to the ICU for a traumatic head injury, our family, like so many others, did not expect what would come next. However, I tell you that as we got progressively more dire news, we did not anticipate that supporting organ donation would mean that our loved one would experience preventable pain, that our family would be pressured and pushed, or that the OPO's involvement would create a fracture in the care team around Chris and increase the grief and trauma our families would experience. My question for you as the new OPTN board is, who is holding the OPOs accountable when the care they deliver is poor quality and otherwise unsafe? I know that Chris would never want this process to be pushed and hastened. He would never want his mom to make that decision. But we are thankful that Chris left the hospital after that admission. He left the hospital after that admission and is still with us today, 8 months later. And as a family, we often wonder how many families do not have that opportunity because they were pushed into donating organs maybe sooner than they needed to be. I think back about that time and I wonder what happened to the OPA staff that was working with us. They went from caring about us and concern for us and compassion for us to cold. And we would pass them in the hallway and they wouldn't even acknowledge us as a family. They wouldn't even acknowledge what we were still going through, all because something had changed and we decided that it wasn't time for Chris to donate his organs. As someone who has worked in healthcare for decades, I want to prevent other families like mine from going through that. We believe strongly in organ donation, but we don't want others to lose their humanity in the process of donating organs. For those of you overseeing the organ procurement organizations through your work on the OPTN, my family wants to know, when did Chris go from being a patient who deserved high quality care and every chance of recovery to quote unquote a donor? Why did the OPO getting involved make his ICU admission much harder on him and his family? And how many other families does this happen to every single day? How many times before I tried to get this message out did someone reach out to the OPTN for help? I challenge all of you in this new time with a new board to ask yourselves, what can I do as a board member to help patients who are referred to OPOs to get better, safer care? What can this board do to protect organ donations from these kinds of OPO mistakes, errors, and quality issues? I thank you on behalf of my family for listening to Chris's story, and I hope that you take action to help all patients who may want to donate their organs. Thank you.
Patty, thank you so very much for sharing with us today.
Thank you. You're welcome.
Thank you, Patty. We will work to address those concerns and we will follow up with you.
We would appreciate that. Thank you so much.
Wonderful. Well, thank you both again, Patty, Yesenia, for those very, very important stories and reminding us all why we are here doing what we do. So thank you so very much. What a wonderful way to kick off this new board term.
Absolutely. Thank you, everybody, for your dedication and commitment to our network.
Thank you.
Thank you.
Bye.
Goodbye. Thank you.
Thank you so much. All right. let me just pause. John, others, any reflections before we move on to the rest of our agenda? Those were very moving stories.
Yeah, I think they call to many thoughts. Again, kind of some of them even some we hear and are used to, and some are totally, caught off guard, if you will. But there are clearly two large issues we need to address. And I think really the Patty story is really not what any of us would ever intend to happen. And I think we need to work on that. I know it's one of the priorities of both the previous board as well as the current board, as well as HRSA. So I think at least I need a moment to chew on it, but I'm honored by the being able to hear the story and the courage it took to tell them. Others? I can't really see all the hands, but please, anyone who wants to speak, please raise your hand. And Christine, can you help? Go ahead.
Yeah, I see Shelley's hand, and I also saw Ray come off mute. So maybe Shelley and then Ray.
Yeah, I think those are important stories, especially the second one with Patty experience. I think there's a lot of misconceptions out there that we have to correct. And there's a lot of process improvement that we need to try and facilitate. And, some of that in that story is OPO blame. I think that we have a lot of work to do with donor hospitals. And what is the role of the care team? When is the OPO really responsible? And how do they interface? And we thought it was obvious, but obviously this story shows it's not, and this experience. So I think that was an incredibly important, painful experience to hear, but it identifies a process gap that we've got to address.
Thank you, Shelley. And Ray, I saw you come off mute and then go back on mute, but I wanted to give you the floor if you had something you wanted to share.
Yeah, I just want to thank Yesenia and Patty. These are hard things to have to come on and say, but the reason they're saying them to you is you were brought forward by the community to do this work. This is what modernization is. This is your job. And we can think about this in terms of meetings and task force and committee attendance, but these are real live patients, and they and their families are depending on all of us to do this work. So a sobering start. And I think that we have the right group, we have the right resources, but this is the important work that you guys are all here for. And I'm tremendously glad to be starting in July with this new team. And I think that we can get this work done.
Thank you, Ray.
Any others? Agree entirely.
Yes, I see a hand. Trying to see who it is. Dan.
Sorry, my camera isn't working, but I think Yersenia's comments as well just reflects, the need to, make sure organ transplantation is available to, as she said, the underserved populations, even though there are a lot of hurdles that go along with that. But I think we have to open our minds and our hearts up to how to make this happen for these
I think Joe had his hand up too.
Yeah, I just like to make a comment, and I really, the stories are very moving, but I really want to just, in my opinion, just stress, I think this is the most serious, almost existential problem that's facing the OPTN right now. This undermines community faith in the transplant process and can literally destroy the specialty of transplantation. So I think we need to take this, and I'm not suggesting that anyone isn't, but the importance of this can't be understated. That's, I think, all I need to, all I really wanted to stress. Thanks.
Agree entirely. Existential threat. All right. And if we'll work on making sure, we'll kind of continue to think about the best way to share thoughts and practices and ideas among the board. The chat for me is always a challenge, but I think I don't want to diminish anyone else's input, but I do think we should keep moving because there are a couple other important agenda items to get to. So thank you.
All right, great. Thank you all. And John, with that, we will push forward through our very packed agenda. So let's move to our next slide. So we have had the opportunity for some of us to introduce each other during some of the office hour and debrief sessions, either before or after the June 9th and 10th meeting, but not everyone was able to attend those. So, and we continue to think it's so important for you all to continue to get to know each other as you continue your board terms. So with keeping in mind that there will be many future opportunities to get to know each other in more detail, we did want to take time on this meeting while we have almost a full quorum of the entire board together for everyone to take about 15-20 seconds max to introduce yourself, where you're coming from, and with the thought that there'll be a lot more opportunity later on. So if we can go to the next slide, and maybe we can start with our new board officers, and then we can just kind of keep running down the list. And we also have a few new members to the board. Darren, the winner of the OPO runoff slot, and then as John stepped into his presidency, we have Austin stepping into the regional role that John vacated. So John, as our new president, do you want to kick us off?
Sure. John McGee, I'm a transplant surgeon at the University of Michigan, primarily adult and pediatric abdominal transplantation. I've been involved in a variety of national efforts, OPO experience, and look forward to working with everybody.
Thank you. Shelley is our VP.
Hi, I'm Shelley Hall. I'm a transplant cardiologist at Baylor University Medical Center in Dallas, Texas. Been involved with UNOS and the OPTN for over 15 years. Mother of 5, married to a cardiologist, and looking forward to pushing up the sleeves and elbow greasing our way through all this.
Thank you, Shelley. Bill Ryan, our VP of Donor and Patient Affairs.
Hi, good morning. Thanks, everybody. Keep things brief. I'm a 2-time donor dad who has been active in this space for almost 40 years, and I'm excited to be a part of the future of donation and transplantation. I lead the Transplant Life Foundation and the Transplant Games of America.
Thank you, Bill. Alan Reed, our treasurer.
Yeah, hi, Alan Reed. I'm a transplant surgeon and the director of the transplant program at the University of Iowa. Originally from New York, did my transplant training in Madison, been at programs big and small, and very much looking forward to moving the needle forward. If this doesn't work out, I just got a message on my phone that Target is looking to recruit me as a greeter. So there you go.
Wonderful.
You've got competition, Dr. Reed. They reached out to me too this morning. So
yeah, somehow I think it wasn't specific, but.
Wonderful. Always good to have job options. And then Justin Wilkerson, our secretary.
Hey, good morning. Justin Wilkerson. I'm a living liver transplant recipient in 2021. My wife was a donor. God bless her. I'm glad to be here. Currently work for National Guard, and I'm excited to join this team and fight for the patients. Thank you.
Thank you, Justin. And then with that, why don't we start in the far left-hand column and just kind of continue down the list. So John Spritzel, we'll start with you.
Hi, everyone. I'm John Spurzel. I am a heart transplant recipient and sepsis survivor. I'm 1 week away from my 8th anniversary of the heart transplant. I'm also CEO of Vivid Diagnostics. It's a venture capital-backed diagnostic company focused on sepsis and antimicrobial resistance. I look forward to working with all of the board members. I think first to strengthen the transparency and trust in our transplant system, and also to support the OPTN vital mission, improving access, equity, and outcomes in organ transplantation. Thank you.
Thank you. Candy. Is Candy Gagne here today with us? You know, we had a few people not able to join. All right, then we also already did Justin, so let's move on to Peter Nicastro.
Hi, I'm
I'm
Peter
sorry, I was
Nicastro. I am a lung and kidney recipient. I've had my lungs for 27 years. I'm a patient representative from St. Louis, Missouri.
Wonderful, thank you. And did I hear Candy break in? Are you here?
Yes, I'm here. I'm sorry, I was on mute. My name's Candy Gagne. I'm from Pittsburgh, Pennsylvania. I'm a kidney transplant recipient, retired from the United States Navy as a hospital corpsman. So I've been working with the system for 47 years now. My daughter is a living donor, and my husband died waiting for a heart and kidney. So I've been a caretaker, a recipient, and I'm glad to be here.
Thank you so much. Jen Benson.
Hi everyone, I'm Jen Benson, thrilled to be here. I will be 10 years post kidney and pancreas recipient this August, founder of 2 organizations, the Transplant Journey Inc. and just recently the Transplant Collective.
Wonderful, thank you. James Casson.
Hi, I'm Jim Cason. I live in Miami, Florida. I'm a 38-year veteran of the U.S. Foreign Service, former mayor of Coral Gables, Florida, and 5 members of my family have had kidney transplants, some of them 2, and I'm on the kidney transplant list, so I'll be going through that journey, and hopefully some of my experiences will be useful for the OPTN.
Thank you so much, Jim. Cody Reynolds.
Chugma Sahochapoet Cody Reynolds, Atali, Tishomingo, Oklahoma. Good morning. My name is Cody Reynolds. I'm Chickasaw. I'm from Tishomingo, Oklahoma. I'm a husband and father of 4 kids, with the youngest being a pediatric liver recipient. It's good to see everybody.
Thank you so much. And John Hodges.
Good afternoon, all. I'm actually on Atlantic Daylight Time. I'm in Canada right now, and the reason that I'm on the board is that I was a living donor 22 years ago, a kidney donor directed to an acquaintance. I've been a discussion forum moderator at Living Donors Online for all that time and more. And I served on the board 14 to 20 years ago. And I'm back on it, hoping that we can do some good work together. I very much hope that all of you remain well while we are meeting. Thank you so much.
Thank you, John. All right, we'll move down to our non-transplant professionals. Gerald Mandy.
Good morning and hello, everyone. I'm Jerry Mand. I'm the non-transplant professional. I'm here. I wrote no to the National Organ Transplant Act in my first job as legislative aide to Al Gore when he was congressman. Most of my career has been in senior governmental positions in the Congress for a decade, and then in the executive branch for 2 decades more, and senior positions in public health and nutrition at the Food and Drug Administration, at the White House, at the Department of Agriculture. I also helped lead OSHA. Today, I'm an academic at Harvard and Tufts, and I also run a nonprofit, Nourish Science.
Thank you so much, Jerry. Mary Hellman. Is Mary able to join us today? Okay, I'm not immediately seeing her on our list. So let's move on to our transplant physicians and surgeon representatives. Let's see, we already did Alan, so Dan Meyer.
Hi, Dan Meyer, cardiothoracic heart and lung transplant surgeon from Baylor University in Dallas. I work with Dr. Hall. I've been involved with you know us for many years, both on the Thoracic Committee and MPSC, and honored to be here on the board of directors with a charge much kind of paralleling what was spoken to today from those heartfelt volunteer comments. So anxious to help improve this great process that we can make better. So thanks for letting me speak.
Thank you, Dan. We'll go to Kimberly Watt.
Kim Watt. I go by Kim unless I'm in trouble, so then you can call me Kimberly. I'm a transplant hepatologist. I'm at Mayo Clinic in Minnesota in Rochester right now. I'm actually Canadian, so happy Canada Day. I'm sure, John, you're enjoying that in Atlantic Canada right now, but I don't see Peggy's vote behind you. I actually lived in Atlantic Canada for my first job outside of meds fellowship and stuff. I'm from the Midwest, though, so I'm back in the Midwest. I'm a hepatologist, been on the liver and testing committee a couple of times, have been on multiple different society level things. I'm completely overwhelmed by this group of humans that we've collected together. You guys are all terrifically amazing, and looking through people's personal statements and stuff, I'm just totally honored to be even listed amongst you amazing humans. So I look forward to this.
Thank you, Kim. George Bayless.
Thank you. I'm George Bayless. I'm a transplant nephrologist in Rhode Island Hospital. I'm very happy to serve on the board. I've done a stint on the ethics committee and as a volunteer on the ad hoc international committee. So I'm pleased to be on the board and help shaping transplant policy going forward.
Thank you, George. And Joe Maglioka.
Hi, Joe Maglioka. I am an abdominal organ transplant surgeon and the director of the Vanderbilt Transplant Center. I spend the vast majority of my time in pediatric liver transplantation, and I've been involved in transplantation literally since my first year of medical school, and I honestly look at this as probably one of the most important jobs that I've had to date. So I'm really excited to be a part of this. Thanks so much.
Great, thank you, Joe. All right, let's move to our non-physician transplant representatives. So Samantha Endicott.
Hi, I'm Sam Endicott. I am the Senior Director of Organ Optimization at New England Donor Services. I've been here for, this is my 18th year, and I was at the Alabama Organ Center, now Legacy of Hope, for 4 years prior to that. I've served on the pediatric as well as the OPO committee, so excited to work with this group to further shape policy for our system.
Thank you, Sam. Kevin Lee.
Good morning, everybody. Kevin Lee. I am with Mid-America Transplant, the organ procurement organization that serves Southern Illinois, Eastern Missouri, and Northeast Arkansas. It's been my privilege to be part of this organization for just coming up on a decade. Like Peter Nicastro, I am also from St. Louis. Unlike many of you, I'm not being recruited to Target as a greeter this morning, so I'm having FOMO about that. But all kidding aside, extremely honored to be part of this group. I've not served on a OPTN committee or on the board before, so a lot of learning ahead, but we do it in service because we are public servants working for the public good.
Thank you, Kevin. Joshua Gossett.
Hi, everyone. Nice to meet you. I'm Josh Gossett. I serve as the director for the Pediatric Transplant Center at Stanford Children's in Palo Alto, California. I have 5 kids also, like Shelly. We connected on that, one of our first board meetings together. I'm also a nurse, and so I'm excited to represent hospitals as a hospital administrator on this committee, as well as nurses in pediatrics. So thank you.
Thank you, Josh. Annette Needham.
Oh, hi. I'm Annette. I'm a quality manager at UC Davis in California. I'm responsible for quality data, regulatory compliance research, and our on-call team. I'm also the current secretary for NATCO, the National Transplant Coordinator Organization. As you can tell from my accent, I'm not from here. I'm originally from England. I came here in 1997, but I've been in transplant almost 30 years in different roles, nurse, NP, coordinator, and manager. I am married, no children, but I do have 3 Bernese mountain dogs that keep me busy, and I'm looking forward to working with everyone to better our community.
Thank you so much. Nanette, I have a Bernese mountain dog sleeping by my feet, so we're going to have to connect on that. Wonderful. Let's move on to Kathy Murphy.
Hi, I'm Kathy Murphy. I am the Histocompatibility and Immunogenetics Laboratory Director at Southwest Immunodiagnostics in San Antonio. I've been on part of the OPTN and UNOS for a long time. I was the chair of the Histocompatibility Committee. I served on the POC Committee, the Kidney Committee, and a continuous distribution ad hoc working group, and wrote some of the guidance documents for the ABO A2 into B recipients information. So I'm looking forward to contributing to the modernization, and patient safety and transparency is one of my primary goals for participating. Thank you.
Thank you, Kathy. And Darren Larman.
Hello, good morning. Darren Larman, Executive Director for LifeLink of Florida, which is based out of Tampa, Florida. My career has largely been clinical. I've been at the bedside, spanning into OPO leadership at a number of different OPOs in very different communities. So I've certainly seen what it looks like when it can work really well, and appreciate the uniqueness of every part of the country. And much like Kevin, I do not have experience on the board or in committee work, so a lot to learn, but really excited at the opportunity to really maximize our presence and help to transform a better future for our donors, our patients, and our community. So thank you for having me.
Thank you so much, Darren. All right, let us move into our regional counselors. Niall Elias has had to step away, so we'll loop back to him. He may have had a patient issue that he's dealing with. So let's move to Kenneth Chauvin.
Hi, everyone. I come to you from the city of brotherly love, home of the Super Bowl defending champion Philadelphia Eagles. I am currently director of abdominal organ transplant at Temple University. I've been involved in transplants for over 30 years, served on liver intestine and PSC in the past, and feel this is a critical time, and look forward to working with you all as we transform the next phase of transplant.
Wonderful. Thank you so much. Ari Cohen.
Hey, good morning. I'm Ari Cohen. I'm the director of the Transplant Institute at the Ochsner Clinic in New Orleans. I do self-identify, though, as an abdominal transplant surgeon, and I'm also Canadian. However, I've lived in New Orleans now for 23 years, and I'm looking forward to help move this system forward.
Thank you. Ryan Davies.
Hi, Ryan Davies. I'm a pediatric heart surgeon and director of the heart transplant program at Children's in Dallas. I have, I guess, somewhere around 10 or 12 years of experience with the OPTN and serving on various committees and chair. And actually, I'm from Canada too, although I left about 40 years ago, so it was a while ago. But apparently a fair number of Canadians on this. So happy to work with everyone. Looking forward to getting stuff done.
Great, thank you. Andrew Cartwright.
Morning, everyone. I'm a transplant pulmonologist at the University of Utah. I'm also a professor in the Department of Philosophy, and I'm a non-directed kidney donor. I've been told my kidney is living a healthy life in Southern California, which sounds lovely.
Thank you, Andrew. Gina Marie Barletta.
Yeah,
Thank
Gina
you.
Marie
Thanks for the
Barletta, but I go
correction.
by Gina, unless someone else stated I'm in trouble. But I'm a pediatric nephrology, and I'm a pediatric nephrologist, and I serve as the medical director at for kidney transplant at Oregon Health and Science University in Portland. I've served as a pediatric kidney transplant director for 3 programs over the past 25 years. And I've also had a personal, not only professional relationship with transplant, having family members as donors, as well as, unfortunately, one of our family members passed away awaiting a heart transplant. I'm very excited to work with this extraordinary board.
Thank you so much, Gina. Reynold Lopez Solar. Is Reynold here with us today? All right, then let's move on to Mark Wakefield.
Hello, Mark Wakefield from the University of Missouri. I'm a transplant urologist and have been inspired by my mentor to be in transplant starting 21 years ago, and look forward to trying to utilize best practices to move forward. I mean, this is a tremendous opportunity to improve transplantation, and look forward to being part of that.
Great, thank you so much, Mark. Mealy Debroy. Mealy able to join? Okay, and I think Austin, who is our new regional rep, is out of the country, but will be with us at our next meeting. So last but not least, Vincent Cassingal.
Hi, I'm Vince Cassingal. I'm an abdominal transplant surgeon, chief of the division here in Charlotte, North Carolina, Atrium Health. Kidney, liver, adult, pediatric. I also perform organ procurement for our OPO here. I've been involved in UNOS committees for a number of years, and as a transplant surgeon, I think what I enjoy most is working on tough problems with the team, which is what transplant does, and I'm looking forward to working with this team to work on some challenging but very impactful issues that lie ahead. Thanks.
Wonderful. Thanks so much, Vince. All right. And before we move on, did I inadvertently miss anyone, or is anyone that we skipped over back with us now? Okay, wonderful. Then let's move on to some of our next voting items. Thank you all so much. I think that was wonderful to take the time to get to know each other. And we're running a little bit behind on our agenda, so we're going to try to tighten up some of our presentations so we have plenty of time for our closed session discussion topics. So next, we want to move into two of our voting items, which are to ratify our election results and to ratify the officers. So if we can go to the next slide, please. So you just saw this. This is the board of directors that we are ratifying into place based on the designation agreement. All of these individuals, you all, will be directors of Invest, which serves as the OPTN Board of Directors. Your term begins today, January 1st. And if we could go to did I say January 1st? I meant July 1st. Apologies. And if we could go on to the next slide, we will also be ratifying in the associate regional counselors who will be serving on the MPSC. And we do have a TBD right now for the Region 10. We are working with the region to select and appoint another regional counselor, as the previous associate regional counselor, Austin, has now stepped into the official regional counselor position on the board, with John McGee becoming president. So we will be backfilling for that. So let's move on to the next slide. And this is a lot of words, so hopefully you had an opportunity to take a peek at this ahead of time, but I'll give everyone a moment to read this text. And again, it mentions some of what I just did, that there was a national election that was held between May 23rd to June 2nd to elect you all as the board members. And then per NOTA, you all have staggered terms in your respective roles, so not everyone will be rolling off at the same time. And then we also have 10 individuals who will be serving as associate regional counselors. So I'll pause for another 30 seconds. Okay, and we're not quite done yet. If we go to the next slide, we have some continued language. So then you are officially ratifying the results. And I'll ask if there is any discussion or questions on this voting topic.
There's a comment in the chat about from John whether or not we need to do anything specific about the Region 10. So there's not a named individual, but I think we can probably cover it, and anyone in these positions is covered. And he will be appointed. Yeah, go ahead.
Oh no, I'm so sorry, John. You're absolutely right. Yeah, the region will be appointing that new associate regional counselor, and so this vote will in fact ratify whoever is selected for that position, even though it is TBD right now.
Right. Okay. And then the motion itself, to just broadly reframe it, is the accepting the invest terms and the insurance coverage, and thanking the previous board for its service. So
yes, we'll actually have a vote a little bit later about insurance coverage. So this is just to ratify that you all are the board of directors starting July 1st.
And do we need to list invest anywhere in our disclosures for anything? Is invest viewed as a separate entity, or?
No, under the designation agreement of the invest, the nonprofit organization of invest essentially serves as, think of it as sort of a shell that encompasses the OPTN board of directors. So it is just the nonprofit organization that serves as the OPTN board of directors.
Thank you. Any other questions? All right, hearing no other items, can we have a motion to, are we going to vote? We're going to vote on this slide, correct now?
Correct, yes.
So these two, so I think, can I have a new motion, since I don't think we were done discussing it?
Motion.
Okay, second.
Second.
All right, thanks, Ari. Any other further discussion? I don't see any hands up. All right, with that, can we go ahead and pop it in the chat for the vote? Again, the yay, nay, or abstain.
Yes, and that voting link is in the chat. So please vote once, and if you're having any issues with the form, we are happy to take your vote either verbally or in the chat.
How are we doing?
Okay, just got the totals tallied. We have 27 approve, 0 reject, and 0 abstain. So wonderful. That passed.
Thank you.
And now election results are ratified. So then if we can move to our next slide, please. We'll now have a second vote to ratify the results of the officer election. And these are your officers.
Motion to approve.
Second. Second.
Any further
Any
discussion?
further?
Christine,
John,
should the officers abstain?
Actually, I'll let Foley Hoag weigh in, but my understanding is the officers you can vote to ratify yourselves into your position. And John, I see your comment. This is for the slate. We're ratifying the entire slate of officers, just like we ratified the results for the entire board. And if we move to the next slide, we'll have actually the voting resolution language for everyone to take a look at. We'll give, and there's also two voting resolution slides. We'll give everyone just a moment to read through this. Melanie, I see your hand up.
Yeah, just weighing in from Foley. Right, so we're approving the slate, not individually. If we were approving individually, normally we would have the recusal of the person not voting on themselves. So it is done as a whole, right? So you can vote for the other ones, but typically you would abstain from voting for yourself, if that helps, or maybe that makes it more confusing.
Yes, thank you for that clarification.
Okay.
Okay, so let's move to the next slide, which is the official resolution language. Oops, sorry, back one slide. Here we go. Yeah. So this is what you're actually voting on, that you are recognizing and ratifying the officer election results as a whole. And the board authorizes and directs these newly elected officers to take on their responsibilities. Okay, John, maybe we should just do one more.
Can we have a motion to support this?
Motion.
Motion.
Second.
Second.
Okay, great. Any further discussion? All right, we can go ahead and pop the vote in the chat again.
Okay, that link is now in the chat. Give people a few more minutes or a few more seconds to complete. Okay, we have 28 approve, 0 reject, and 0 abstain. So our officers are now ratified. Wonderful.
Thank you.
All right. Great orders of business taken care of. So we get started. All right, then let us move forward to our next slide. All right, I'm going to speak very briefly about some next steps that we are going to take for Invest insurance coverage to make sure as volunteers and serving on the OPTN Board of Directors, you are all well protected with insurance coverage in your roles. So if you could move on to the next slide, please. Okay, so just very briefly, currently, the Invest insurance coverage just includes directors and officers and employment practices liability coverage. And that is a $5 million policy. And the D&O covers any financial loss made alleging a wrongful act, a misstatement, a breach of duty, neglect or error, misleading statement, or act of omission. And the employment practice liability coverage claims making during the policy period alleging employment practices, wrongful acts such as discrimination or wrongful termination. So this is what the board currently has as far as insurance. However, this expires as of July 23rd. So AIR's, the board support contractor, is working to renew insurance coverage. And with our partners at Foley Hoag and HRSA, we also are exploring increased insurance coverage because we did find after careful review that there were some gaps, and we want to make sure that we have as robust of insurance coverage for you all as possible. So right now we are getting quotes from a nonprofit insurance broker to look at increasing the D&O and EPL liability coverage. So looking at policies in excess of $5 million. And we are also looking at adding errors and omissions coverage, which will include cyber liability coverage and some bodily injury coverage. So E&O coverage claims, that's when there is an alleged error or omission in rendering any part of your performance of professional services for others. So maybe someone thinks there was a mistake made in a OPTN policy that was put forth, would be an example of that. And the cyber insurance, we work in a virtual environment, and while we put as many practices as in place with Box, etc., cyber insurance will cover any third-party liability claims associated with cyber incidents or breaches of confidential information. And we are also exploring the potential need for additional medical professional liability insurance, since this group does make policy decisions that can directly affect patients. And we're just exploring with the lawyers if that would be needed in addition to the bodily injury coverage that would already be included in the errors and omissions. So again, this is just a high level update. We're exploring what all these policies would look like, what the costs are, what it would take to get increased coverage. And this will make sure that there is coverage so nothing is lapsing. So this will be getting in place in the next couple of weeks before that July 23rd date. And Kim, it's not per person. This is for the entire board. So you as a member of the board would not in any case be, sued, or there wouldn't be a claim directly to each one of you. So this is, as the board votes to make decisions, this is coverage that would encompass the entire board. And so Foley Hoag is the legal team that supports you for any of your legal needs. They are a subcontractor to AIR. Previously, you just heard from Melanie Bartlett, who is a member of that team and a partner at Foley Hoag. So they will always be on board meetings to advise for any legal issues and are available for any additional needs that come up. And the one thing that we want to vote on today is to ensure that the insurance coverage that is purchased for Invest also includes covered persons that are the board of directors and the OPTN committee members and other volunteers, because we know that there are many standing committees that are doing that policy research, that are putting forth those policy updates or suggestions. And there are other work groups that on behalf of the board or other committees are pulled together to review patient safety cases, review claims, etc. And so the next voting action, and let's go to the next slide, is really to ensure that we have approved language that that any of the committees or any other OPTN volunteers are covered as a manager under Invest, and they are acting on behalf of Invest. So they will also be covered under these insurance policies. So I will let folks read that, and happy to take any questions.
And the team, the legal team has looked over this as well. I mean, many of us, with a good 6 months, I'm not sure I can figure it all out, but many of us are looking at it in a short term. So
yeah, so this is all our wonderful legal team at Foley Hoeg puts together all of these resolutions, and they have reviewed all of this to ensure that whatever insurance coverage we're bringing on will cover not only you all as the board, but the OPTN committees and other volunteers.
okay, Alan has a question.
Yeah, so I work at a state institution. We can't get sued personally. The Board of Regents can get sued on our behalf. What's the status on the Board of Directors? Can the Board of Directors be sued, or can we be sued as individuals?
Melanie, I'll let you speak to that, but my understanding is it would not be possible for you to be sued as individuals. It would have to be suing as the board. If it is based on it, if they are taking exception to a board decision or policy.
Right. So, sorry. So Invest, right, as we've discussed, is actually a Delaware nonprofit, and they serve as the board of the OPTN by the designation agreement with HRSA. And so the board in its capacity as the board can get sued for decisions. As an individual, I mean, we will follow up with you on that. I don't think we've quite gone down. We have not been posed that question yet, but you are not, right? It's a public-private partnership under, again, a Delaware entity that is a nonprofit with 501c3 status. It was set up purposely to separate that, but yes, apologies, but we will nail that down for you.
Appreciate the follow-up. Thank you.
Including potentially, Alan and I can't be sued, or there's a difference between being sued and being successfully sued. So I guess the question is also, are we free from being named, or we would be named and then not followed up on?
Just to add in briefly, this is Andrew Leonard from Foley Hoeg. We'll look into that. I'll say that, you know, there's no way to ever prevent some random plaintiff from naming a person in a lawsuit, right? I mean, like putting it on the complaint in the first case. There are arguments that, you know, you can make that we might feel strongly about, and this is what we'll follow you up on getting you out of that in your personal capacity more easily. But there's no way to prevent random plaintiffs from just naming individuals.
Agree. Thanks. Any other questions?
So I think the reason that I think the reason we ask is every year we need to fill out a form at our institutions saying, have we been named in any lawsuits, or have we been party to any lawsuits? So for us, John and I and all the physicians, I think on here, and probably, you know, many other folks, it's important for us to know. Thank you.
And I think John had a question, if I'm.
Yes. So acknowledging we have 22 days to get this done, what is the timeline for getting the quotes, and what's the process for approving the policies?
I'm speaking on mute, so I'll let HRSA weigh in, but we have already collected a lot of policies and quotes. So we will be meeting with HRSA very shortly to review those with them. Then the policies would be purchased through AIR on behalf of the Invest board. And once decisions are made based on prices, etc., we will loop back with you all as the board. Stephanie or anybody from HRSA want to say anything else about that process? But things are going to be happening very, very quickly. We kind of have all the pieces already in hand. So we're not just at the beginning stages of getting quotes. We do have quotes in hand, and it's more just reviewing the fine print and selecting which ones we want to move forward with.
What's the confidence level that it gets done before the expiration of the current policy?
100%. It'll get,
Okay,
yeah,
awesome.
we're going to get this
Awesome.
done. Yeah, there will be no lapse in coverage. Yeah.
Okay, thank you.
And in fact, you will have more coverage by July 23rd because we're not looking at anything that does not expand the coverage beyond what you already have.
So I think we need a motion to approve this, if I'm following correctly.
Motion.
That is correct. Yeah, and this is not
Okay,
about
great.
purchasing the insurance. This is just
Second.
to ensure that
I'm sorry
the
to
community.
break in. I'm sorry to break in. The text doesn't end with a period. Is there more?
No. So that is just a minor typo that will not affect the voting. So this is it, what you're seeing on the screen.
Okay.
All right. Any additional discussion?
I don't see any hands.
All right. Then let us put in the voting link.
I don't have a voting link.
I think you can pop it in the chat.
Yeah, so Mealy, it should be in the chat. It came in from George
As a form?
Barnett at
Okay, I see it.
12:23. Yes, it is a form.
It's a form. I see it.
Okay, great. We have 30 approve, 0 reject, and 0 abstain. So that's wonderful. Thank you so much. All right, before we move on, we knew that this board meeting was going to be very, very packed, and I think we had some great discussion, and intros took a bit longer, though I think it was very time well spent. So we are running a little up against the clock here, and John, I'll turn to you for your thoughts here. We had 2 other presentations that were going to come from AIR on creating board culture with a little bit of an interactive activity, and then also some reviewing of upcoming board priorities and activities. Yeah. In the interest of ensuring that we have plenty of time for the closed discussion actions, what are your thoughts on postponing those 2 AIR presentations to the meeting on July 17th so we can still preserve time for the closed session?
Thanks for asking. I think the culture, obviously insanely important, but it was mostly an open-ended discussion with a couple points. I'm not sure 15 minutes was enough to cover it, and I'm not sure delaying it for a week, 2 weeks will make a big difference. So I certainly would suggest we skip the culture questions. And then the board priority activities, I think, were the ones that were very briefly listed, which I think are both in the materials. So do you think, how long were you, the board priority topic?
I mean, I think we could just do a very brief, high level 5-minute sort of review of that. And so if we could move forward to slide 23. Why don't, I'm going to turn it over to my colleague Lee. And Lee, could you just do a quick overview of some of these next steps and in maybe about 5 minutes?
Yes, thank you. I can be very brief. So just wanted to signal that we sent out a list of priorities that the new board identified during the June orientation sessions. It was part of the email that you all received yesterday related to this meeting. And this slide also lists some of the priorities that you raised. And we really want this to be your list of priorities. So we are inviting the new board to edit the list in the board box account and happy to walk you through that process if you need help. We did send out a document describing how to edit the document in Box. We've seen that some of you have already started working on the document, which is really exciting. And so again, we want this to be your list of priorities and really encourage the board to look at the list and make comments and additions before the next board meeting to help you focus how you would like to spend your time on July 17th. What priorities would you like to discuss during that July 17th meeting? I'll also just make one note that in addition to your list of priorities, AIR and HRSA also developed a list of priorities. We've kept them in separate documents for now. We can certainly work with you to combine them if that would be helpful. But in the list that HRSA and AIR created, which reflects requirements in the final rule and reflects ongoing priorities related to patient safety issues, there is a note in there about potentially updating the 2024 through 2027 OPTN strategic plan. This was something that came up during the orientation sessions with the new board. And so for this item, we just wanted to note that OPTN discovery contracts are currently documenting and evaluating the current state of IT modernization, patient-centered communication, policy development, and financial management of the OPTN. And we think that findings from these contracts could be really informative to discussions that you all may have about potentially updating the OPTN strategic plan. So just wanted to signal that there is information coming to the new board later this summer, again, that could be helpful in helping you think through what, if any, revisions to make to the OPTN strategic plan. So just wanted you all to have that on your radar. So Christine, that was really all I wanted to say. Yeah, please go ahead.
Yeah, I think that in the interest of time, if you have thoughts, please feel free to either edit the documents or email the executive committee. I suspect we will have at least 2 meetings before the actual next board meeting and kind of reconnoiter and get a high level overview. We're roughly 30 minutes ahead of you guys. So I think, 2 weeks to kind of reframe and make sure we think about everything that's on the list would be good. And it will be a dynamic process too, because strategic plans rarely last very long if you're doing stuff. So please email us if any question. And with that, I think we should move over to the closed session just to make sure we get some of the high items that we need to be on our radar.
Great. Thank you, John. Will do. Okay, so we're going to be moving into closed session. We're going to take a quick pause to end our live stream. So thanks for those that were listening in. So we will end the live stream now.